Let us move on to Dr. KEIZO TAKEMI, Minister of Health, Labor, and Welfare, to deliver the keynote speech on the current state with future prospects of regenerative medicine in Japan. The floor is yours. I would like to deliver my speech in English today.
I'm so delighted having this wonderful occasion to talk about investing in Japanese regenerative medicines. This is my favorite subject. In this case, I would like to talk about the Ministry of Health, Labor and Welfare's the quite new initiative concerning the development of a global ecosystem and aimed at fostering the startup of cutting-edge drug discovery, such as regenerative medicine. We are currently a major turning point in the field of regenerative medicine and drug discovery, as you may know. Especially in Japan, where the aging population is advancing. The impact of medical innovation of the lives of citizens is significant. The current Japanese society faces several major challenges, particularly declining the birth rates, the speedy aging population, and the rapid advancement of the globalization and digitalization are greatly affecting our healthcare and long-term care systems. In the field of regenerative medicine, the innovative treatments are continuously emerging, opening up the new paths for patients to live healthier and the longer lives. At the same time, ensuring the sustainability of our universal health insurance system, which guarantees the access to medical care for the entire population, is absolutely essential. The most pressing challenge we face today is how to maintain this system while also incorporating the cutting-edge innovation in healthcare and long-term care, to realize the society where the citizens can live long and healthy lives, especially in this era where the people may live for a century. In this context, Ministry of Health, Labor and Welfare announced the quote, near future healthcare ecosystem strategy, unquote, on August the 30, 2024. This is a quite outstanding new challenging the paper publicized by the Ministry of Health and Labor. This strategy aims to address the healthcare and long-term care challenges that Japan will face in the coming years by promoting innovation and the dynamics of the society to foster the health and active participation of the population. Now, this strategy is based on several critical concerns. It is essential to evolve our healthcare and long-term care systems to meet the changes brought by the aging population, digitalization, and globalization. By incorporating economic and social dynamics into the healthcare and long-term care, we aim not only to reduce the medical expenses, but also to create new value and foster the sustainable growth. The strategy's goals are threefold. The first goal is to strategically nurture the healthcare and the long-term care industries by balancing the domestic reforms and international strategies, harnessing the vitality of overseas markets for the benefit of Japan's economy. For example, leveraging foreign technologies and capital to strengthen Japan's healthcare industry will enable us to provide the medical services that are in the demand globally. The second goal is to expand the revenue in the healthcare and long-term care sectors while maintaining the universal health insurance system. This requires not only utilizing cutting-edge technologies and innovations, but also reforming and streamlining the healthcare and long-term care delivery systems. Efforts such as the promotion of telemedicine and addressing the issue of uneven distribution of doctors fall under this category. This is also very important. The decision has already made by the Ministry of Health and Welfare and Labor. The third goal is to create an environment where each individual can live a healthy and meaningful life for as long as possible, actively participating in a society. This entails not only improving the quality of healthcare and long-term care, but also building a system that supports human promotion throughout the society. And then, another key initiative in the field of regenerative medicine and pharmaceutical advancement is the quote, building of a global drug discovery ecosystem. Building of a global drug discovery ecosystem. Near future, the quote, near future healthcare ecosystem strategy highlights these initiatives from the both international and domestic perspectives. You can imagine this is a real symbol of the changes of the decision-making within the Ministry of Health and Welfare and Labor. In the most of the time, the ministry has been very domestic-oriented, not always think about those the internal issues under the external context, but changed. We are now trying to challenge to combine the both within the one umbrella. Well, building a global drug discovery ecosystem, especially this initiative seeks to establish the framework that promotes innovative drug discovery by fostering collaboration between various players in Japan and abroad, including industry, government, academia, as well as through the sharing of capital and technologies. By linking Japan's innovative academic research with drug discovery, we aim to eliminate the drug lags and drug losses, ultimately providing groundbreaking pharmaceuticals to the public. To achieve this, we will ensure the necessary budget for the projects and the infrastructure that I will now describe, which will help attract further private investment and rebuild and strengthen Japan's drug discovery foundation through the development of an ecosystem. We have already had so many experiences during the pandemic of the COVID-19. Those ecosystems always exist beyond the national boundaries. And then, how ourselves, Japan, has the basis, academic basis, as a part of the ecosystem in a global context. This is the big challenge. To achieve this, we will ensure the necessary budget for the projects and the infrastructure that I will now describe, which will help attract further private investment and rebuild and strengthen Japan's drug discovery foundation through the development of an ecosystem, as I mentioned. So in order to realize this, it is necessary for not only the private sector, but also the public and private sectors to work together on an ongoing basis. And we will consider the ways to provide the support, including creating a fund. Furthermore, through these initiatives, we aim to position Japan as a, quote, hub for drug discovery, unquote, contributing not only domestically, but also to the people of Asia and beyond. This is particularly important for the development of pharmaceuticals needed to address changes in disease patterns in the Asian Pacific region, where the elderly population is rapidly increasing in this region, Asian Pacific. And let me now elaborate the construction of the drug discovery ecosystem. The drug discovery ecosystem knows no borders. In fact, it can only flourish when connected to other ecosystems and players around the world, utilizing their strengths by actively attracting overseas talent and capital with practical expertise in commercialization. We aim to position Japan as a, quote, hub for drug discovery, unquote, that contribute to the global universal health coverage. To this end, we plan to establish a public and private next fiscal year where the government, domestic and international pharmaceutical companies and the venture capitals can discuss the construction of the ecosystem. Next, let's discuss the strengthening of the drug discovery cluster. Japan already has several outstanding drug discovery clusters, and the seeds of an ecosystem for drug discovery are beginning to take roots. By actively supporting these clusters to address the functions they lack, such as by providing the necessary resources, we aim to attract the further private investments and foster the development of these drug discovery clusters. Now I would like to talk about the support for the commercialization of promising seeds for academia. Japan's academia holds the many highly potential seeds of innovation. In order to ensure these seeds are effectively commercialized, it is important to connect the experts in both the basic research and the practical application, such as by providing the early stage support from experts experienced in the drug commercialization. The government will ensure the necessary budget for establishing a system and infrastructure to attract further private investments to these initiatives. In addition, we will provide the financial support for research aimed at obtaining the necessary data for the commercialization of treatments for diseases with high social demand, such as cancer and rare diseases, by supporting promising non-clinical stage seeds from the academia. Let me discuss the establishment of a clinical trial system and manufacturing support for innovative modalities in the field of pharmaceutical development and new modalities, such as regenerative medical products, emerging one after another. To accomplish these new modalities, we need to strengthen the existing clinical trial and manufacturing infrastructure. One key area is the establishment of a system of conducting first-in-human clinical trials. In Japan, unfortunately, we don't have so many the facilities for the first-in-human yet. But we should have much more in the most efficient way. In Japan, we are working to enhance the system and the support provided by the Pharmaceuticals and Medical Device Agency, PMDA, to make the first-in-human trials more competitive domestically. In addition, the development of manufacturing personnel is also a crucial part of the strategy. By providing practical training using actual production facilities, we aim to cultivate the skilled workforce required by the pharmaceutical industry. Through these efforts, we ask to enhance the international competitiveness of Japan's pharmaceutical industry and to position Japan as a global hub for the drug discovery. Regarding to the aforementioned the drug discovery clusters, for example, in London, the Francis Crick Institute and in Boston, institutes like MIT and Harvard University serve as a hub for pharmaceutical startups, producing the numerous successful startups. To cultivate the drug discovery clusters that revival these, we will work to establish an ecosystem in Japan that is not confined to the domestic border. Let me talk about the image of the public-private partnership for the drug discovery. Now I would like to explain, quote, public-private partnership, the drug discovery platform projects, unquote. One concept aimed at ensuring the commercialization of promising seeds from academia. Quite fortunately, still there are a large size of the potentiality of the research and development in the Japan's academias. How we can more efficiently connect the seeds of academia and the potentiality to the pharmaceutical development in a particular manner. How we can accelerate those processes. This is a big challenge we have to do. As shown in the central image, the slide, this framework envisions top-to-tier accelerations identifying promising seeds from academia, supporting them through proof of concept, POC, and first-in-human trials, and providing integrated management throughout the commercialization process. The key point of this framework is the establishment of a system that nurtures and develops the attractive seeds. We believe that it is essential to have the accelerators participating in this framework with the world-class achievement. It's a bit unfortunate thing is that the Japanese has not such a large size of the able accelerators yet. Therefore, maybe when we design those skills as a whole, we have to invite those really the able accelerators from abroad, I think. And then, to enhance the effectiveness and sustainability of this framework, in addition to the public funding, we will also need support from domestic and international funds and the venture capitals. Can you imagine the Ministry of Health and Labor try to raise the financial resources, not only from those domestic, the budgeting system within the government. Now we are starting to think how to raise those financial resources from the private sectors, not only Japanese pharmaceutical industries, but also the outside of our own country. No border. And by providing support from the early stages, where the risks are high and the private support alone may be insufficient, the government aims to facilitate the growth of these initiatives into the middle and large stages, which can attract the further public and private investment. Therefore, you may review some very interesting articles, such as the mission economy. The mission economy describes the role of the governance under the public and private collaboration in order to stimulate those new industrial capacities. We are doing in this manner. The government try to take the initiative to create the new challenges under the public and the private collaboration. We will actively seek input from investors regarding this framework and will hold discussions to further concretize the concept. Lastly, I would like to touch on the regenerative medicine. Today we have heard from Professor Norimasa Nakamura from Osaka University of Health and Medical Sciences, and later. And we will hear from entrepreneurs working to bring regenerative medicine to the public. I believe Japan's regenerative medical technology is something to be proud of on the global stage. For example, at the Keio University Hospital, in collaboration with National Hospital Organization, Murayama Medical Center, which has high expertise and outstanding achievements in treating the patients with the spinal cord injuries. They are conducting the first in-human clinical research on the transplantation of a neural progenitor cells derived from the human iPS cells. The Ministry of Health and Welfare is supporting this research through the AMED, the Japan's funding agency for medical research and development. So this is the quite new architecture. Try to design the scheme to accelerate the development of the drug discovery through the regenerative medicine. With the emergence of the technology such as iPS cell, we have continued to develop the safe regenerative medicine for patients through the Act on the Safety of Regenerative Medicine, which was enacted 10 years ago. However, since the enacting of this law, significant progress has been made thanks to the efforts of those involved in regenerative medicine in Japan. One such advancement is in the in vivo gene therapy. In vivo gene therapy involves the direct administration of vital vectors or the genomic editing enzymes into the body, offering promising therapeutic effects. However, it also presents the risks such as the transmission of infections and the potential development of cancer. to address these risks and safely promote these emerging technologies. We revised the law this year to include in vivo gene therapy under the Act on the Safety of Regenerative Medicine. Moving forward, we will continue to create an environment that enables the safe provision of regenerative medicine and will work to foster innovation in this field. I hope that today's event will be a fruitful experience for all the participants, and I really delighted at this wonderful occasion. I really appreciate that the many audiences are here in this hall, but also through the internet. More than 500 audiences we have abroad. Therefore, today I use the English as a language to deliver my own speech. But this is one of symbolic the stage we have already entered into. Because now the new challenge should be always over the national borders. And the ecosystem should consist of so many players widespread all over the world. That's the reason why today I use the English to talk about how the Japanese government started the new challenge in this field. Thank you very much for your patience.
Thank you very much, Honorable Minister Dr. Takemi. Thank you very much once again for taking time out of your very busy schedule due to official engagements.